Good morning, everyone. We have a lot to talk about today, and of course, we're going to be talking about in a few minutes the situation with our vaccine supply and everything we're doing to fight COVID. But I'm starting on a different topic today. I'm starting on the biggest fight that we will be fighting for years ahead, the existential fight. And that's the fight against climate change, the thing we all need to focus on. And New York City is leading the way. And I got to tell you, I am optimistic. I'm optimistic that we can make a big difference in this city and set a positive example for this whole nation. I'm wearing my green tie today out of optimism and also because it's an important day for New York City and something really, really momentous is happening this week in terms of changing the way we go about living, getting away from fossil fuels once and for all, and moving forward to renewable energy. Now, the city obviously has long had a commitment, but the commitment is now turning into action. Just yesterday, New York City pension funds announced that we'll be divesting $4 billion from fossil fuels. $4 billion. And that comes from two very large elements of our pension system, the New York City employees retirement system and the New York City teachers retirement system. This will be the largest fossil fuel divestment in the nation in history. And it is a difference maker. I want to thank all of the elected officials who are members of the pension boards. I want to thank the union leaders and all of the members of the unions who are part of the pension boards. Everyone came together in common cause to protect Mother Earth and to deal with a problem that needs aggressive action. So today, what we're talking about is so powerful. It is about literally protecting our Earth, protecting our children and grandchildren, using our power. Now, let's remember, we watched with horror as President Trump pulled the United States out of the Paris Agreement on climate change. Thank God, President Biden's taken us right back in. But remember, we have power here in this city to make a huge difference. One of the greatest cities in the world, we're able to make a difference by our actions. Our divestment action has encouraged cities around the country, cities around the world to do the same thing. Just in the last few days, Seattle followed the same path because they saw New York City's leadership. That's something all New Yorkers should be proud of. And I want to thank again everyone involved. I want you to hear from some of the people who worked really hard to make this possible. And first, someone who I had the honor of announcing this whole new approach with several years ago. It's now come to fruition with this $4 billion announcement. My pleasure to introduce the Comptroller of the City of New York, Scott Stringer.
Well, thank you, Mayor de Blasio, for bringing us all here together, and I'm proud to have partnered with you, as well as Public Advocate Jamani Williams, DC 37 Executive Director Henry Garrido, Teamsters Local Leader 237 Greg Floyd, all the trustees, and Bill McGibbon, our environmental leader. I also want to thank all the activists who made this happen. This is a momentous day for our city and for our future. 3 years ago, we stood together and said loud and clear, climate change is the most pressing challenge of our time. And we committed back then to use every tool at our disposal to protect our pensions and our planet against the threat of fossil fuels and big oil. And I'm very proud of that today. 1 year ago, we started a path towards a comprehensive and prudent divestment strategy because we knew the future was on the side of big ideas in clean energy, not with big polluters. And today, we are announcing, as you said, Mayor, that the New York City pension funds will divest an estimated $4 billion from fossil fuel companies, one of the largest divestments in the world. And today is made possible by so many people, from our trustees whose leadership and steadfast commitment to retirement security kept this process on track, to investment experts who made sure that every step of this process was responsible, thoughtful, and fiduciarily sound, to advocates who sounded the alarm about the growing financial and environmental risks posed by climate change. Because of all of you, New York City is leading the way toward a clean, green, and sustainable economy. Make no mistake, the impacts of the actions we are announcing today will be felt for generations to come. And it's my sincere hope that other municipalities around the country will take note and follow our lead, that divestment from fossil fuels is possible and necessary. Smart investment policy and smart climate solutions go hand in hand. And we are putting our money where our mouth is. And we're doing this for future generations, for our children and for our retirees. This is an amazing effort that I think will change the course of history. And I'm very honored to be here with all the people who played such an important role. Thank you for bringing us together.
Thank you so much, Scott, and thanks for your leadership. And again, this has been an effort where so many people have contributed to the vision and making it come alive. But when it comes to the vision itself, the original thought here, someone who deserves tremendous credit for years ago, many years ago, sounding the alarm about global warming, showing us just how dangerous it could be, and then leading the way in terms of divestment, showing us that we had tools to fight back and we could make a difference with the power of our dollars. He is literally one of the founders of the effort to stop climate change and to protect the earth. Author, advocate, co-founder of 350.org. Pleasure to introduce Bill McKibben.
Mr. Mayor, thank you very much. What a pleasure to get to join with you all. Look, when Naomi Klein and I kind of started this divestment idea a decade ago, we did not, I think, honestly, anticipate days like today. This has turned into one of the largest campaigns of its kind in history. We're closing in on $15 trillion in endowments and portfolios and pension funds that have divested. But along that story, along that route, nothing has been more important than the decision of the city of New York. Naomi and I were able to join you 3 years ago for the first announcement of this. And what I said at the time was, I thought this was particularly significant because of the signal it sent that the financial center of the world had gotten this message. And I said, I thought that New York's actions would be heard loud and clear. And they have been, to some extent, by other cities around the country and around the world. Paris and London, two of the other great financial centers of the world, have now joined in this effort, and that's powerful and important to see. But it's also been heard profoundly on Wall Street. It's one of the things that set in motion the chain of events that's led, even today, to the announcement from BlackRock, biggest asset manager on earth, that it was going to insist that every company in its portfolio get on a net zero pathway. Last night, Chuck Schumer, senator from New York, and a man with deep and long ties to Wall Street and the financial industry, gave a remarkable interview in which he described the climate emergency we're in and the need for the US government to take it on absolutely full steam. So I think that the activists who made this happen in the first place, my colleagues at 350 across New York, the people at New York Communities for Change, the incredible diverse activist base that reflects the diversity of the greatest city, most interesting city on the planet, I think that they deserve great credit for figuring out how to make this event have so much leverage. That's what we look for often in financial systems, is leverage, ways to make things happen on the scale that we need. There are so many parts to the climate problem, and cities, including New York, are working hard on housing and on transit and on bicycles and on pipelines and on retrofits, and it's all important. But finance is one of the important places too, a place where a city can exert outsized influence. And New York City has done that. New York City should be very, very proud of what it's accomplished. And I have just the greatest, I'll just finish by saying, the greatest admiration for those who actually made it happen. 3 years ago, remember, there were a number of cynics who were saying, oh, well, it's just an announcement. Can they actually make it happen? And I know that there are lots of players here, including the comptroller, who have worked with extraordinary diligence to go through the not insignificant process of figuring out how to actually do this. And so extraordinarily grateful. And just to say, New York as it has so many times in the past, is setting the tempo here and raising the bar.
Thank you, Bill. Thank you. Bill, I'm so appreciative for everything you said, and it's so much from the heart, I can tell. And I remember that day. It was a beautiful day when we got together a few years ago. And thank you to you and Naomi and all the activists who were there that day representing this extraordinary movement in New York and beyond. I also have to say to my fellow mayors, I worked with Mayor Khan of London on this divestment effort, and I showed him what we had done in New York, and London has done a great job following through. Our teams talked with the mayor of Paris, Anne Hidalgo. We are working around the country and working around the world with your leadership. And what I'm finding is the more people we show it can be done right, and it can make a difference, the more people want to join. So thank you so much. And I want to turn to our labor partners who've made a huge difference here. They were absolutely committed. Their involvement is what actually makes this possible, because they have to look out for the retirees, but they also understand this is about saving the earth for everyone, and there's a way to do both. I want you to hear from two of our labor leaders. First, the executive director of DC 37 AFSCME, Henry Garrido.
Thank you, Mr. Mayor, and good morning, everyone. I really thought you were wearing that green tie in honor of the DC 37 colors, but I guess we'll
it serves both purposes.
Well, listen, those of you who know me know that one of my favorite phrases is that of Einstein, is the definition of doing the same thing over and over again and different results. To me, as a trustee, as a leader of the largest union in the city, it just seemed insane that we were going on the path of investing in the fossil fuel industry that was not producing the results that it had promised from the onset, that it was leading to decay of our climate, that it was putting our future at risk. And so I'm very proud today to stand in support of the divestment of the $4 billion in fossil fuels. And for those of the colleagues of other unions who have been hesitant to do that, I will say to you this is a beginning, and we want just to join us going further. If you look at fossil fuel as an investment itself, you will see that the returns have been really dismal. So from the perspective of investment for the retirees, this isn't just some sort of publicity stunt that is calling for divestment because it is a popular thing to do. It is also the right thing to do for the retirees, for the activists, and for the members of the pension. Especially now, given COVID, where you have major slowdown in the use of oil, where people are staying more at home and driving less cars. That has actually added to the from the pension perspective. From the environmental perspective, look, I could not forget Hurricane Sandy literally into our office of DC 37 and flooding our building all the way up to the second floor, which displays our headquarters at DC 37 in downtown Manhattan. And how many other businesses, how many other families were affected by it in areas like Staten Island, in areas in the short of Brooklyn. And we saw a complete devastation of our communities by the climate change effect. So I want to thank the mayor. I want to thank the controller. I want to thank my fellow trustees. This was not done, it lightly. We actually hired a consultant who helped us guide through the process. So we did this intelligently. And on behalf of my members, I'm very proud to stand here in support of the divestment of fossil fuels. Thank you.
Thank you very much, Henry. And now I want you to hear from another leader who's played a crucial role in this effort and represents so many crucial city workers, folks who make our housing authority run, and our school safety agents, and so many other good folks who serve us. The president of Local 237 of the Teamsters, Greg Floyd.
Thank you, Mayor de Blasio. Thank you for this opportunity to speak on this divestment. I want to thank the controller, Scott Stringer, for commissioning and doing the 15-year study that made us comfortable with agreeing to divest from fossil fuels. I want to thank my fellow trustees also for patience and listening and not just doing a knee-jerk reaction. And what we found out is that over the last 15 years, if we would have invested in something else, we could have done equally as well, if not better. Furthermore, the way of the future is going toward electric cars. Electric cars means using less fuel. Using less fuel means the investment in fuel companies will be diminished. So this is the right time to divest from fossil fuels and not hurt the pension funds going into the future. So that's what we were concerned about. And it's always a plus when we can help the environment, help the community, and do the right thing. So I want to thank everybody who was involved. I want to thank everybody for their patience in studying this issue. And I'm proud to be part of the team leading the way for the future of our environment. Thank you.
Thank you so much, Greg. Thank you for your leadership. And one more person I want you to hear from, also a member of the Pension Fund Board of NYCers, as I used to be when I was public advocate, and he understands fully the power of the grassroots. This has been so much of his life, and it's a great example today, grassroots power, demanding change, and then our leaders turning it into action with this divestment. Pleasure to introduce our public advocate, Jumaane Williams.
Thank you so much, Mr. Mayor, for convening us and for the opportunity to speak on this issue and for your leadership on the issue. And with yesterday's NYCers vote, we're at last achieving a goal that's set forward to divest from fossil fuel owners and advance a new commitment to green energy solutions. We're now putting actions to the words, which is critically important. As we have seen, the future of energy and energy investment is in green infrastructure and green output. Divesting from polluters is a financial strength in addition to a climate justice imperative. Climate change shows the instability of the kinds of old energy we are now divesting from. We all have a responsibility in New York to pursue sustainable futures for both our pensions and our planet. And it's clear we can't do it alone, but we should never underestimate the power of New York moving something forward nationally and globally, and what our market share means to so many things. This is an area where we have an obligation to lead with vision, with action. We're all relieved that the country is now back in the Paris Climate Accords. I was proud that even when the nation wasn't, our city still kept its commitments. We have to make up lost ground for the past 4 years, taking us a little bit backwards. But these agreements are the floor, they're not the ceiling. New York should be a progressive beacon. So together with my appointee, Elizabeth Guzman, I want to give her a shout out, all of the elected officials and advocates who are here today. This is a great day. I want to make sure we also show the equity issue. Even though climate change is going to hit us all hard, Black and brown communities, as usual, are most affected. So I want to shout out those advocates and activists who sometimes don't get the shine they need, like New York Community for Change, like Uprose, so many who've been working on these issues for such a long time. But I'm proud to take this step financially and for the environmental health responsibility. And I think it's great for the city to see their leaders working together on these issues. Thank you.
Thank you very much, Jumaane. Thank you for your leadership, and thank you for shouting out a lot of good people who have done the work. All right, now I'm going to turn from this crucial divestment and what we're doing to protect the planet now and for the future, going to bring us back to the here and now, the fight against the coronavirus and the latest developments. Let me first give an update on New York City's effort as of the end of yesterday. We had vaccinated 650,546 doses. So we had provided 650,546 doses to the people of this city. That is more people than the total population of Portland, Oregon. We're going to keep giving you updates each day and compare with other places around the country just to give you scale, but it's literally as if we had vaccinated every single human being in Portland, Oregon. That's the scale we're working on now. We could be doing so much more. Right now, I need hundreds of thousands more doses per week. I know that in February we can reach a level of 500,000 vaccinations per week if we had the supply. Now, I'll just tell you, over these last days, my team and I have been constantly talking with members of the Biden administration. I'm always encouraged by those conversations because I hear focus and urgency and creativity. As you heard, President Biden upped the goal yesterday. I think that's fantastic and the right thing to do. This morning, I spoke with Jeff Zients, who is the White House COVID coordinator. Always accessible and providing us a sense of where they're going, listening to our concerns. I'm very, very convinced that the commitment is there, and we're going to see a lot of impact from the Biden White House. In the meantime, right now, we're dealing with the residue of what was left to us previously, and we have almost no supply to allow us to create new opportunities for people, new appointments for people. As of this morning, we have just about 7,700 doses on hand. But the bigger challenge here, I talked about it earlier this morning, is that we have doses that are waiting for that second dose use, but for over 2 weeks in the future. As of the end of yesterday, that number was almost 100,000 doses. We've got to make sense of this situation, and we need the help of all of our partners, because here's an opportunity to do something here now. Just put those second doses into play, particularly when we know the Biden administration is going to move manufacturing of the vaccine more quickly, particularly when we know the Johnson & Johnson vaccine is coming, could just be weeks away. I really believe that when we move the second doses up and use them for first doses whenever possible, it just allows us to do the most essential thing, which is protect people. 50% protection for a senior citizen is so much better than no protection at all. Again, spend some time with our seniors and you hear this loud and clear. Whenever I've talked to a senior about what this means to them, it sounds obvious, but I'm going to say it. It's a matter of life and death. The fear that senior citizens have been living in for the last year is overwhelming. Even some protection matters so much to them. Obviously, medically as well as emotionally. We owe it to our seniors to use everything we've got and know that more supply is coming. So we're going to keep fighting to do that, to make a difference for our seniors. Now, let's remember, every person we vaccinate takes us one step closer to our recovery. It's as simple as that. Every person we vaccinate is another person who's not going to get this disease. And that's what's going to move this city forward. So every day we're looking for every way to speed this up, open up more sites, bring it to the people. And that's essential. We need the most grassroots effort possible. The more decentralized, the more localized, the more neighborhood-based, the more trust there will be, the more impact, the more people we will reach. That's our game plan. All right, let me do one quick thing before we go to our indicators. We have some weather starting to hit us this morning. I always will say to people, you're never sure what you're getting from Mother Nature. So the initial reports have been pretty modest, but we've taken real precautions because many a time we get surprised by a sudden uptick in the amount of snow or the speed of a storm. So National Weather Service has issued a winter weather advisory. We expect snow and sleet all day. We do expect slick conditions, icy conditions later on in the day. I really want to urge people, if you don't need to drive today, don't, particularly the evening rush hour could be really slippery and difficult. I want to just urge folks, if you can stay home, stay home. If you can take mass transit, take mass transit. If you can get out earlier, if you have to get home, it's going to get worse, obviously, as we get later into the day and evening. So everyone take precautions today. Alternate side parking is suspended today, but outdoor dining will be going on. So I'll make sure people get that. Alternate side parking suspended. We expect this weather in the course of today, but it's not enough as of what we're seeing now to interfere with outdoor dining. So outdoor dining will be open, but bundle up and stay warm out there. And then final point, everyone, as always, help your neighbors. New York City People in New York City help each other. It's the beauty of this place. There's a senior citizen in your neighborhood or someone who really could use some help shoveling or any kind of help at all as they go through this weather, please look out for them. It makes a huge, huge difference. Okay, let's talk about our indicators. Number one, daily number of people admitted to New York City hospitals for suspected COVID-19. Today's report, 230 patients, and the hospitalization rate per 100,000, 5.14. Current new cases, today's number on a 7-day average, 4,844. And number three, percentage of New York City residents testing positive on a 7-day rolling average, 8.4%. Few words in Spanish, and once again on the really important announcement today on climate change. Seguimos dando grandes pasos para que nuestra ciudad y los neoyorquinos tengan un mejor futuro. A partir de ahora, el Fondo de Pensión de la Ciudad no va a invertir más el dinero en petróleo, carbón o gas. Esta decisión va a proteger el futuro de nuestro planeta y de todos nosotros. With that, let's turn to our colleagues in the media. Please let me know the name and outlet of each journalist.
We'll now begin our Q&A. As a reminder, we're joined today by Dr. Choksi, by Dr. Katz, by Chief Climate Policy Advisor Dan Zarilli, by Sanitation Commissioner Edward Grayson, and by Senior Advisor Dr. Jay Varma. First question today goes to Juliet from 1010 Wins.
Oh, hi. Good morning, Mr. Mayor. Good morning, everyone. My first question, actually, Mr. Mayor, since you just mentioned outdoor dining, the governor yesterday said New York City not ready yet for indoor dining. So I was wondering, what have your conversations been like with the governor about this, and how are you pushing to or encouraging him to do something specific about indoor dining in New York City?
I appreciate that question a lot, Juliet, because so many New Yorkers are, really ready to support our local businesses. And I remind everyone it's Restaurant Week, but with a twist. It's Restaurant Week to go this week. And please, there are amazing deals out there and great opportunity to patronize our restaurants right now on delivery and takeout basis. But to Juliet's question, look, I think about the neighborhoods, the restaurants in my neighborhood. I think about the people who work there. I would love to see them come back fully. I'd love to see more and more people employed. I'd love to see these businesses built up with people's hands, make it through. But right now, the central focus is health and safety. So at this moment, we obviously still have way too many cases in this city. We have these new variants that we're watching really carefully. We're going to be governed by the data and the science. Right now, the data and the science tells us be careful. So I will just say every conversation I've ever had with the governor and his team, they are also entirely focused on the data and the science. And, our goal, of course, is to get people vaccinated, and then the answer is clear. Then we're in a position to reopen a lot of things. But right now, we got to be really careful about the numbers we're seeing. Go ahead, Juliet.
Okay, given that you just asked about variants, I have a question for you and for your health experts. There's been discussion about the variants and needing 2 masks to double mask or better masks. What are your health experts' thoughts on that? Is that advisable? Should people be doing this?
Let me turn to Dr. Varma, because we were just talking in detail last night about the new variants and what we know. And Dr. Varma, why don't you start with just a quick overview of what we know and don't know about the new variants at this point, because there's obviously some alarm out there. We want to set that straight. And then you can speak to the double mask idea.
Yeah, thank you very much for the question. We're very carefully monitoring the situation both here in New York City as well as both nationally and globally. So what we know is, as we've said before, that all viruses mutate, and they particularly have the opportunity to mutate when they're inside a human. So the single best way we can prevent against these mutations is to prevent people from getting infected. The 3 strains that we are most concerned about and people have been tracking They are referred to by these very technical names, but people are also referring to them by the countries in which they were first detected, in the UK, in South Africa, and Brazil. What we know so far quite definitively is that these strains appear to be more infectious. That is, one person is more likely to transmit infection to another person than the strains that have normally been circulating here in the United States. We are starting to see some evidence out of the UK that it may also be that some of these strains that are found in the UK may also be a little bit more dangerous. That is still preliminary information. It doesn't quite have the solid sort of founding of multiple different studies, so we're tracking it very carefully. But what's really most concerning is this infectiousness, because the more it can spread, the more people that are ultimately infected and the more complications you can have. We don't know for sure why these are more infectious. That's something that is still being evaluated and understood. So in the meantime, your question about masks is very, very important, and it's something we've actually been discussing actively. I think our current thinking right now, and we're going to hopefully be able to come out with some more strict guidance very soon on this, is that, first of all, you should always wear a mask. And our single biggest problem is actually people not wearing any face covering outside of the home. And so we really, really want to emphasize to people the importance of wearing it correctly and consistently at all times. That's number one. And then number two is, if you have the opportunity to wear more than one mask, it is more likely that it's going to be helpful than it's going to be harmful. And in fact, myself, I now am more starting to wear a surgical mask covered by a fabric mask. So that is really the current thinking that we have right now, that more is probably better, even though we don't know for sure why these new strains are more infectious.
Thank you very much. Go ahead.
The next we have Courtney Gross from New York One.
Hi, Mr. Mayor. How are you?
Good, Courtney. How you been?
I'm good, thank you. I wanted to talk about the second dose issue. And the way I'm interpreting your comments both this morning and Morning Joe and today is that the pool of second doses that you have, the 100,000 or so, you say send them out right now, right? So what do you say to the person who has an appointment 2 weeks from now to get that second dose? Are you basically telling people that you only need the one dose, or that's better than nothing?
No.
Can you guarantee the second doses will happen?
Oh, yeah, listen, it's a very, very important question. Thank you for asking it, because this is exactly the thing where we want to make sure people fully understand what's going on. We're absolutely committed to everyone getting their second dose, period. Everyone will get a second dose. Anyone who gets a first dose will get a second dose. The question is timing in the context of the scarcity we're experiencing. So the CDC last week said, a second dose, of course, the ideal is give it the exact day that you're first eligible for it, which, depending on the vaccine, is either 3 weeks or 4 weeks after your first dose. That's the perfect world. What we're seeing, Courtney, is we are not living in the perfect world right now. We are living in a world of total scarcity when it comes to this vaccine. So the CDC said, if that second dose is even up to 6 weeks after its perfect date, it's still entirely effective. You want to get it to people the first available moment. But if there is a small amount of lag, it's still entirely effective. Dr. Varma has spoken to that previously in these press conferences as well. So I'm saying, so as of yesterday, we had almost 100,000 doses that could not be given for 2 weeks or more because there weren't enough people qualified yet that they'd gone the time frame to be able to get a second dose. So those doses, as I said, almost 100,000 at that point, were sitting in refrigerators that are going to have to wait for 2 weeks, and then they get applied. I'm saying, let's use what we have now, because we obviously see more efforts being made to increase supply. We know Johnson & Johnson is coming. And even if we have to say to people, your second dose is going to be slightly delayed, it's still better to get a first dose in as many people's arms as possible to give them that 50% protection. That's what I'm arguing. Otherwise, what we're left with is a situation where we can do very few vaccinations at all. We're just stuck right now because we don't have supply. Go ahead, Courtney.
And then what you said you talked to the White House this morning. So what kind of guarantee or indication from them did you get that there would actually be an increase of supply? And then do you have numbers on how many doses the city is slated to get this week, and how many cancellations you also had to do appointment-wise?
I will turn to Dr. Choksi on the latter point about what the numbers are looking at right now. I'm just going to hold up a summary from Department of Health website. And one of the things they've done to clarify now, which is really important, is showing how many first doses are on hand as of this morning. Fewer than 7,700 doses left, first doses, but over 200,000 second doses, including, as I said, some that are way off, their use will be way off in the future. So this is, I think, very, very helpful and clear. I'll let Dr. Choksi speak about the latest on the appointments. Look, obviously, Courtney, I want to respect conversations with the White House in terms of the specificity. They'll be making their own announcements when they're ready. What I can say, just sort of compositing it for you, is came away from the conversation very confident about the direction they're taking and confident that things are going to get better in the coming days. Dr. Choksi, you want to add on appointments and how many we've had to cancel?
Yes, sir. Thank you. So for the specific question about how many first doses we're expecting this week, it's approximately 107,000 that we're expecting. Those deliveries will occur over today and tomorrow, and that will allow us to fulfill the appointments that have been scheduled through the course of this week. The goal, of course, is to not have to cancel or reschedule any appointments. But the fact of the matter is that if we have more supply, we would be able to schedule additional appointments beyond what we're expecting for this week. One of the important points here with respect to the conversation with the federal government is we know what our allocation is for this week. We'll find out either today or tomorrow what our allocation will be for next week. But for the planning purposes that the mayor has described, we really need to know that for a far longer time frame to be able to plan out, prepare, and schedule appointments accordingly.
Amen.
The next is Katie from the Wall Street Journal.
Hey, good morning, everyone. I did want to ask about the vaccine distribution, particularly with the second doses. Have you had to reschedule anyone's rescheduled appointments at any point? I know that there are some people who were rescheduled for some time after last week, but I just don't know if you have that data. And then a follow-up to that is just asking about the percentage of non-New Yorkers who are getting it. Do you have any information on whether it's just people who don't work for the city? Obviously, lots of city employees live outside, but I don't know if you have that information.
I'll turn to Dr. Choksi on the cancellation of appointments, what we've experienced the last week or two. And we'll get more detailed information out shortly on the composition in general. There's several things we'll be talking about and putting out publicly on the composition of who's been vaccinated. What I want to emphasize is a lot of the people who serve us, who work in our hospitals in the 5 boroughs, who patrol our streets, who keep us safe from fire and emergencies, who work in our schools, a lot of those folks live outside the 5 boroughs. And from day one of the vaccination effort, it's been clear that those folks who work for us, serve us, we want them vaccinated, and we're ready to vaccinate them right here in New York City, in addition to our own residents. That has been the central thrust. So we'll get specific numbers, but of course, you're going to see in those numbers, and it's been true from the beginning, substantial number of people who are not from the city, but who do serve the city, and that's absolutely appropriate. Dr. Choksi, again, clarifying on how it has gone with having to cancel, or postpone is a better word, postpone, reschedule certain appointments, including for second doses. Just give some kind of overview on that, would be helpful.
Yes, sir, I'll be happy to, and thank you for the question. I'll talk about it with respect to first dose appointments and then with respect to second dose appointments. For first dose appointments, there were some appointments that had to be rescheduled from the end of last week. Those are now all rescheduled for the end of this week. And we have ensured that the supply that we're getting from the federal government this week will fulfill those appointments that have been scheduled. Those are just for city sites and specifically for the health department hubs that I'm referring to. We do know that other hospital systems and other places that are administering vaccine have had to reschedule some of their appointments as well, again, due to the supply issues. So that's for first dose appointments. And then briefly on second dose appointments, anyone who receives a first dose appointment either already has or will receive a second dose appointment. In the vast majority of cases, this is scheduled, at the time of the first dose appointment. And when that doesn't happen for whatever reason, there are multiple safeguards in place to ensure that someone who has a first dose appointment will get a second dose appointment according to the right schedule.
Thank you. Go ahead, Katie.
Thanks. And my second question, I know the last time it snowed in the city, a lot of the restaurant, well, a few, I don't want to say a lot, but there were a decent amount of restaurants in the city had a little fun poking at, the fact that outdoor dining was still open, given the weather conditions. Would you consider dining outside tonight? I don't know, show some solidarity for the restaurants. I know you're from New England. You guys do that for fun, maybe hang out in the snow?
Yeah, I have done outdoor dining in this kind of temperature and not a problem at all for me. I'm able to do it. Let me see about my schedule. Let me see if I can get someplace, and at least if I can't stay, maybe I can get some takeout or something. But this is perfectly good weather, and there's a lot of great outdoor dining setups that have really kept people real warm and safe. They've done great. So I encourage everyone, have a winter adventure tonight. Go ahead.
The next is Andrew Siff from WNBC.
Hey, good morning, Mr. Mayor. Can you hear me?
Yeah, Andrew, how you doing?
Good. I wanted to just step back a couple of weeks to your daily drumbeat when you were asking the state for the freedom to vaccinate relentlessly, and you prevailed to get them to open up to Category 1B. But at the time, what Governor Cuomo told us, as far as his reluctance to do that, was the moment he did it, we'd run out of vaccine. And sure enough, we ran out of vaccine. Does any part of you sort of regret that expansion before we had the supply to fulfill it?
No, not at all, Andrew. I appreciate the question. I'll tell you why I don't regret it. First of all, based on everything we understood at the time, we expected ever expanding supply. I think that is coming. I would have expected to see more evidence of it already, but I think it's coming. Second, we were seeing in a lot of the categories, those 1A categories, real hesitancy. We had, some places where we were expecting a lot of people want to get vaccinated. We were getting 30% or 40% or 50% of those eligible who were passing on it. But meanwhile, we had seniors who felt literally their lives were in danger, and they were right, who wanted the vaccine right now, who are anxious for it. I am absolutely glad we fought for the freedom to vaccinate, and every single senior who's even gotten their first shot will tell you it was the right thing to do. Go ahead.
Follows up on Courtney and others who've asked about the second shot. You sound awfully confident that Johnson & Johnson and other supplies are coming in. Do you not have concerns that if you do delay the second shot for folks who think they're getting it, that some kind of an obstacle, an unanticipated problem, might then jeopardize the protection for folks who are counting on that second shot?
You have to always be concerned, Andrew. It would be irresponsible not to be worried, not to be concerned about any potential impact. But I'll tell you something. We've seen a trajectory already with these vaccines. The projected reality has come to pass very consistently. Dr. Varma spoke yesterday about Johnson & Johnson. Nothing's a sure thing in life, but we like what we're seeing, and we're very hopeful about it being a tight time frame, literally a matter of weeks before you'll start to see doses start to flow. And it's a single dose vaccine, which changes the entire discussion. I'm going by a real simple theory here, Andrew. I got a whole lot of people need a first dose. I've talked to people what that first dose means for them, how it makes them feel hope, how it makes them feel protected, and they in fact are protected Even 50% protection is better than none, to say the least. I don't think it's right to hold back the first dose from people who would be so appreciative, who would make so much of an impact on their life, when we know that we have a new administration in Washington that's going to speed supply, and we have more vaccines coming, new vaccines coming, and ones that'll be even faster and easier to use because it's a single dose. Why on earth would we hesitate? And we know it is safe even if someone has to wait a bit for that second dose, that when they get it, it will have full impact. You could argue either side of it, but I feel passionately, I want to protect as many people as possible. I'd rather give more people some protection than fewer people all protection, because again, talk to any senior citizen who feels vulnerable. I can't look them in the eye and say, hey, we could be giving you some help right now, but we're going to hold it back. It just doesn't make sense to me.
The next is Henry Goldman from Bloomberg.
Mr. Mayor, how are you doing today?
I'm doing okay, Henry. How you doing in our winter wonderland today?
Doing pretty well, hanging in there. Looking forward to June, July baseball season.
It's coming, Henry.
Yep. Let me ask you a question about the distribution, the demography of distribution. At the outset, there was a lot of emphasis on getting the vaccine to people who have been historically disenfranchised, disproportionately affected. How is the demography shaping up in terms of who's getting the vaccine in New York? Are these people being served, or do we have a problem here?
Well, we're going to be providing the data later on this week, and I'll be getting a fuller briefing on that. What we know is we always have to focus efforts on the communities hardest hit by COVID. They are the most vulnerable communities in this city for so many reasons, because of what we already learned painfully with their experience with COVID already, because these are also communities where people have gotten historically much less health care than they deserve. So unquestionably, the data is going to continue to remind us of that fact, but we'll put out the specifics. And I think what is so crucial here is building trust. This is why I keep saying you cannot have a vaccination effort with just big central locations. Those are great, but that's not enough. You have to go deep into communities. If you're going to fight disparity, if you're going to make sure that people have real concerns about the vaccine, have those concerns answered, you have to go deep into communities. You have to get community organizations involved. You have to go, as we've been doing, right into public housing developments. You need clergy and community leaders there themselves encouraging people. That's how you fight the disparities. Go ahead, Henry.
Okay. When do you think the city will be able to get past the supply problem and really have a system that's running on all cylinders, where the vaccine supply is adequate and up to the task of running a 24/7 operation out of Citi Field, Yankee Stadium, etc.?
Yeah.
When is that going on?
I'll tell you two answers that are both true, but are different parts of the equation. Our ability to hit 500,000 vaccinations per week, February, unquestionably, February, I'd say first or second week, but definitely February. The supply, I can't give you an exact date on the supply. I can tell you that if the federal government was able to either intensify supply or improve delivery or do some shifting of supply to where there are places with very fast distribution versus places with slower, and then backfill after that, that could make a huge difference. That might get us to the level we need. Certainly Johnson & Johnson might get us to the level we need, and that's potentially just a few weeks away. I don't have the perfect date when we have the supply to go with the 500,000 per week rate. I know our capacity to go to 500,000 a week is in basically the next week or two. Go ahead, Henry. Oh, I'm sorry. We got both. Go ahead.
The next is Kayla from Fox 5.
Hi, Mayor de Blasio. How are you?
Good, Kayla. How you been?
Good. My first question is piggybacking off of the first question about indoor dining. It sounds like you agree with Governor Cuomo at this point, his stance on not allowing indoor dining in New York City just yet. But there are other regions in New York State, well, everywhere in New York State for that matter, with higher positivity rates that have been allowed indoor dining in some capacity, and they too are seeing their numbers come down. DC, another city that's starting to allow indoor dining at a 25% capacity. So can you just clarify why you're still in favor of keeping those businesses closed?
Yeah, Kayla, thank you for the question. Again, let's go right back to the data and the science. You said the most important words. There are places that have seen their numbers come down and then they reopen indoor dining. That's exactly what we want. I want to see indoor dining reopen when it's safe. We're obviously the biggest city in the country, incredibly densely packed place. We were the epicenter of this crisis. We lost tens of thousands of New Yorkers. We're going to be really careful and smart about when we let people get back together in close proximity with their masks off because they're eating and drinking, because this has been an issue all over the world. So when the numbers come down, and we're confident that it's staying down, that is a great time to do it. But obviously, we're not seeing that yet. I gave you the numbers earlier, and we're worried about these new variants. So that's what's on my mind. Go ahead, Kayla, I'm sorry.
No worries. My second question is somewhat similar. It's about the wedding industry. A lot of people postponed their 2020 wedding to 2021 and are now wondering if they should be pushing their date a second, maybe third time. Given the vaccine rollout has been somewhat messy, let's just say, I wonder if the city is considering ways to allow larger gatherings under conditions that there's maybe proof of vaccination, rapid testing. The uncertainty, of course, puts a bunch of industries in tough positions: catering, venues, florists, so forth.
It's a very important question. What I'd say is, I get why people are frustrated, obviously, because we all want this vaccination, all over the country, want to see vaccination move much, much more quickly for everyone's good. I got to say, sort of from a perspective of appreciating things, I'm still want to note the fact that we got a vaccine in December was a miracle to begin with. And the fact that this country is approaching 1 million vaccinations a day is not a minor matter. That's still a really good thing. We got to go a lot faster. But to your point about weddings and all, look, if we can have tools that will help us to give people the standards that will protect them, that's something I want to see us do. But I think we're not quite there yet because, again, unfortunately, we've seen increases in cases in recent weeks by a lot more people in the hospital. We have the new variants we're worrying about. I don't like the notion of us thinking about big gatherings indoors in that atmosphere. I think as things start to turn, we can do more and more to figure out how can we facilitate the right kind of gatherings. But the real answer, if someone said to me, in fact, someone did at my barbershop last week, they said, hey, I was planning a wedding for April, what should I do? And I said, I got to tell you, you're going to be a lot better off in the summer with the rate we're going with vaccination. I would not be planning a wedding for the spring if I had the option to do it for the summer. Now, I understand folks want to get married and make cases as fast as possible. They might want to consider getting, a civil or religious ceremony to become married, but doing the gathering, the party, the reception in the summer. That is just my common sense advice. But we are going to look for ways to help once we see a real improvement in the healthcare situation.
We have time for 2 more for today. The next is Kevin Duggan from the Brooklyn Paper.
Hey, Mayor, how you doing?
I'm doing good, Kevin, and I'm a big fan of the Brooklyn Papers, and it makes me feel young again because I used to read them all the time when I was a school board member and a city council member.
That's great to hear. I want to go a little bit off topic to a very Brooklyn topic. A year ago, your expert panel released a report on the BQE, and I was wondering where things stand there ever since. I know we've had the pandemic, obviously that's taken a lot of resources, and it still will with the budget, but you have Polly Trottenberg at the US DOT now and a new administration. I guess, what are your plans for the BQE in your last year in office?
Yeah, we'll be speaking to that much more in the next few weeks, Kevin. I want to say having Polly Trottenberg as the number 2 person at the U.S. Department of Transportation is a great blessing for this city. She and I talked about the BQE a lot. I know she really feels urgency to help us find solutions and support. But we talked about this yesterday as well. The repairs have been done over the last year or two to keep shoring up the situation. We're doing more work on enforcement on oversized trucks. That's going to really re-engage now as we start to move out of the pandemic. But we do need that long-term plan. And that's what we'll be saying more on in the coming weeks, because it's important to start that work and prepare for the next administration to carry it through and really protect people for years to come. Go ahead, Kevin.
Yeah, I guess just as a follow-up, so just to confirm, so have you been speaking with Polly Trottenberg since she assumed her new position about BQE?
I have not talked to her about the BQE. I talked to her to congratulate her, and I was just really, really happy for her and proud for our administration when we see people like Polly reach that role, and of course, Deanne Criswell, who's going to be the national FEMA administrator, who is also going to be in a position to help us a lot. It makes me very proud. Polly and I have talked particularly about Vision Zero, which I am passionate about, and using it as a national model. I think she'll be able to do a lot with that in her new role. But we certainly will be talking in the weeks ahead on the BQE as well.
Last question for today goes to Andrea from WCBS.
Good morning. My first question is about homebound seniors. Council members and state lawmakers are going to be unveiling a plan later this afternoon. Where does the city's plan stand? And if there isn't one yet, are you all open to hearing suggestions from the community?
Yeah, so I'll start and I will turn to Dr. Choksi, and then if Dr. Katz or Dr. Varma want to add. We're always open. Look, we're in the middle of a crisis, Andrea. We are always open to good ideas. And over the last couple of weeks, we've talked about homebound seniors as a particular challenge. Now, for seniors who can get around, we announced different transportation options to help them get to vaccinations for seniors who didn't have their own transportation. And I think that's going pretty well. But homebound seniors who literally need an individualized approach, someone able to give the vaccine safely has to go to their home. That's obviously much more complex, takes a lot of labor, but we're devoted to getting it done, particularly as we get more vaccine. So Dr. Choksi will give you our latest thinking on that, and then we certainly look forward to the suggestions from the legislators.
Yes, thank you very much, Mr. Mayor. And this is such an important issue with respect to ensuring that we're getting vaccinations to some of the people who will most benefit from it. Certainly, I think about the patients that I've taken care of over the years who have limited mobility or are fully homebound, and it's particularly important for us to be able to serve them. As the mayor has alluded to, we're really thinking about this in 3 primary ways. The first is ensuring that the sites that we set up, particularly city sites, but also working with other partners who are vaccinating, to make them as accessible as possible. Setting up areas where people who find it difficult to walk or need a wheelchair are able to access those sites as easily as possible. That's number 1. Number 2, as the mayor has said, is ensuring that we have transportation options for people who may be partially homebound or may require further assistance with respect to actually getting to a place where vaccine is delivered. And then the third part is acknowledging that there are some homebound seniors who will not be able to leave their homes. And that means bringing the vaccine to them. We're actively planning for this, both in NYCHA developments as well as more broadly, to set up more mobile options for vaccination. We do have to be upfront about the fact that the vaccines that we have, for them to remain safe and effective, do have certain handling and transport requirements. And so, of course, we want to do it in a safe way that still meets those access imperatives.
Thank you. Go ahead, Andrea.
Second question is just to piggyback on the kind of the equity framework when you're talking about going into communities, using clergy and stuff. Can we just go a little bit deeper about that? Because just because a site may open up in a hard-hit community does not necessarily mean that community are the ones that are getting the vaccine. People have been coming from all over the city to just try to get this coveted vaccine. What are you doing in terms of an information campaign? Are Zoom meetings happening? Are people knocking on doors? Is there something more personal happening to convince people?
Yeah, all of that has begun and will deepen. That's absolutely the approach. Our vaccine command center from the beginning, with the leadership of Deputy Mayor Melanie Hartzog, has been devoted to creating a grassroots effort with a heavy outreach component, literally down to things like the knocking on doors and the Zoom meetings, as you said, town hall meetings via Zoom, getting the maximum amount of local community leadership up front in the process, using community healthcare providers, using community-based organizations to lead the way locally. There's going to be hesitancy. Look, we already know, we knew it from the beginning. There is a lot of hesitancy in general. That's not a news flash. Clearly, the clear majority of New Yorkers want the vaccine, but there's still a lot of hesitancy in a variety of communities. We know that hesitancy is intensified in communities of color where there's been mistrust and historical evidence of why people should feel mistrust because of things that happened that the government and the medical community did over the years and did wrong because of institutional racism. That mistrust, unfortunately, comes from someplace real. But the answer to it is to just make the vaccine as easily available, widely available, with as many community trusted voices connected to it. And I think you're going to see a human thing happen, Andrea, where folks will see someone they trust offering the vaccine or someone they trust getting the vaccine, and that's going to encourage them. And it takes some time, but it creates kind of a virtuous cycle and things move forward. That's the basic game plan. Doctors, Katz, Choksi, Varma, anything I left out that you want to add?
I think you covered it, sir.
Okay. Unless someone else jumps in, I'm going to assume I got it. Okay. Everyone, as we conclude today, look, we got a lot of work ahead, but I am really optimistic when it comes to our vaccine effort because, as I said, I know when we get to full speed, 500,000 vaccinations a week, it's going to have an amazing impact and a really quick impact on the people of the city. And I really do have confidence in the administration of Washington that they're going to help us get it done. But in the meantime, we remember there's a lot of other things we have to do. We have to get ready to bring this city back fully, our recovery ahead. We have so much to do together. And today we spoke about the biggest challenge going forward, which is climate change. But today's conversation is a hopeful one because we can do something about climate change. Just like we're doing something at record speed as a nation, thank God, to fight the coronavirus, we can do something about climate change. Today's announcement that we're taking money away from fossil fuels, putting money into renewable energy, this is the shape of things to come. And New York City is literally leading the way. We're seeing cities all over the world deciding it's right for them because they saw New York City do it first. So New Yorkers should be proud of the way we can spark positive change and we can make a difference. And that's what we're going to keep doing. Thank you, everybody.